is the Chief Executive of Blackpool Teaching Hospitals. We're working with Maggie on a number of pieces of work to fundamentally land on the idea of what the future of health should look like in terms of a provider perspective, particularly now based on what RF has talked about, the idea of place. Thank you for joining us, Maggie. I know you're in the middle of a conference in London, and we're grateful you joined us. If you can now go through your perspective in your vast experience, which is, by the way, you started as a theatre nurse many years ago, to having led a number of organisations across the NHS. If I then ask you to take us through your slide deck and then get to some questions. Over to you, Maggie.
Thanks, Nadine, and good afternoon, colleagues. I do apologise if you get any background noise from me. I am in a rather busy conference venue. Wasn't even on my agenda when I agreed to be part of this today. And I'm also sorry we haven't got more time today, because I've been fascinated by what the previous speakers have had to contribute. And I do feel like we're kindred spirits, and we didn't even know each other before we started to do the prep for today's session. And I'm really grateful for Nadeem and his colleagues for inviting me. We are short on time, and I do want to help all colleagues move to the Q&A so that we can take some of the interesting comments that have been coming on the Q&A bar. So I'm going to canter through the few slides that I've got, and more will be there for people after the seminar. And if anyone wants to pick up any of the points that I canter through today, then I'm more than happy to contact them outside of the short amount of time today. So before we move to my slides, I want to stress the point. It's okay. We can move into them. I want to stress the point that others have made, particularly Arif. I 42 years ago this year joined the NHS, and I think this role that I've currently got is the privilege of my career. I'm going to talk to you about deprivation and the impacts that has, and my responsibility, and other people like me, our responsibility to really reach out to the workforce to support people who are, one, working in such challenged environments, but two, not only do they work in a challenged environment, but they live and are a product of that challenged local geography. We are talking today in a brief amount of time about the challenges. I wish we had more time. I could put half a dozen slides up in front of you that show you that despite the challenges, we are managing to pull off some amazing innovations and a huge amount of caring around our local population. It's not all doom and gloom, as Arif said. And one of the comments in the chat bar around, we're like the Vegas of the North. Well, you certainly don't need a huge amount of money to come, but we like to come and spend your pound with us, because every pound in our local economy helps us enormously. So we'll move on and we'll canter through these, if we may, Nadine. So every conference you go to, everyone wants to be the bottom of the pack for these. It's like we all want to be, look at us, we're this, we're that, we're the other. But we have got some really, really tragic stats to share with you. You know, life expectancy for us in Blackpool is below the English average. And we know that the deprivation in our area is the 10 most deprived wards in the country. We've got 8 in Blackpool. Now, we're not proud of that, but we're not ashamed of it either. And as Arif has outlined, there's a huge amount of work across our place. People like me and Arif, and many of you on this call, we've been working at place since before it was a place. And I just wish we could do something about the terminology that's been fostered upon us in more recent years. But we know that we've got high rates of chronic illness. And I want to focus my few slides really on the women in Blackpool and the unique health and socioeconomic challenges that they face. So the slide indicates that women here have a worse life expectancy than other parts of the country. And that's quite shocking. And we, as the biggest employer in the public sector, need to recognise that and do something about it. So next slide, please, if I may. Again, unemployment rates amongst women are high, and women's mental health is high. Women living in deprivation is high. Smoking rates amongst women is high. Low birth weight in our babies is high. Teenage pregnancy rates remain high. And the boxes on the right, which I know are difficult for you to read today, a recent study that comes out annually about where's it hardest to grow up in the country, female. Well, really sadly, it indicated that for the women and young girls in Blackpool, we're the second hardest part of the country to grow up female. So next slide, please, if we may. But what do we know about our workforce? Well, this probably to me is the most interesting slide that I wanted to just focus on. So 77% of my workforce comes from my local area, and 77% of my workforce is female. So it would be wrong of me and our board not to focus on what does that actually mean for us in the organisation. We haven't got all this right yet. I think what's important to me is that we're curious and we're starting to move into this space in a more formal sense. So if you see the lovely, we all love a coloured bar chart in the NHSA. If you look at the first four lines, you'll see the red indicates our most deprived areas, and you'll see that in our lowest bandings from band 2 to 5, that we have got a huge amount of our workforce from those areas. And that's really significant for us because, as I've said previously, and as Arif alluded to, we know we've got an ageing population. We know we've got an lower than average life expectancy. We know that we've got several areas where health deprivation is impacting on life expectancy rates. We also know we've got a high level of domestic violence in Blackpool and surrounding areas. And we've got a high level of ex-military forces, and colleagues on the call will recognise some of the challenges that that brings to us from a physical and mental health perspective. Next slide, if I may, please. One of the issues that we face in Blackpool, and I'm going to comment on two cases. One has been very well publicised in the press, and we featured on Crime Watch twice. But we still have a live murder inquiry in Blackpool of a patient who was so severely sexually assaulted that they subsequently died from their injuries. And if anyone's interested, you can still Google and look at the Crime Watch clip, two Crime Watch clips. We still await police informing us of when we can move forward from that. We have high rates of misogyny identified in our staff survey, and we know from that previous slide that I put up that growing up female in Blackpool is full of challenges, and many of them are around the inequalities that people feel just from the basis of their gender. And I know we could talk about other personal characteristics, all which have their own impact. Just for this session, I'm focusing on what it's like to be a woman and some of the things that we're trying to do in our trust. We also, again, it's been in the national news, and case not concluded yet, will come to court next summer. It will be for the courts to make a judgment. But we've got a member of staff who faces 14 charges of sexual assault on nursing staff who CPS felt they had enough evidence to take to court. The case is due to be heard next year. So one of the things we're doing in relation to that is we're not ignoring it, and it's a very sensitive subject, isn't it? I mean, it's really difficult to talk about these things, but we're not ignoring that. We are following NHSE's toolkits, and we've got our sexual safety charter, but we are trying to absolutely out some of the issues that our female staff are reporting to us and our local communities say are real. Because, as you know, if we've got these biases, then our patients and our staff will take those biases through into the interactions they're having with our community. And if we don't break the cycle, then we are in that self-fulfilling prophecy. So I'm going to canter on. I could talk all day on this stuff, but I know we haven't got time. So next slide, if I may, please. What are we doing to try and support all of the health inequalities? Well, like yourselves in your own organisation, you'll have countless networks. What we are determined to do as a board is make sure that these networks aren't on the fringe of what we do, but we really have to change our culture so that they drive what we need to do. And there's nothing outside of those networks that you're not going to be familiar with, from the NHS toolkits that are available to all of us. And I think that was probably, is there another slide, I think, Nadeem, or was that the last slide? Yeah, that's the last slide. So in summary, I want to just pick up on what Nadeem said at the beginning. The pandemic, without a doubt, shone a light on health inequalities. And for me, in the position I hold, not only was I seeing the effect on our patients, but I was absolutely seeing the effect on our staff. And I think it was mentioned earlier by one of the other speakers, some of the patients that we saw in our intensive care unit were our staff. Now, they weren't just staff because they were being exposed to coronavirus through their job, but they were absolutely members of our local populations. We're doing a piece of work to drill down on absolutely what's the impact of sickness on those bands. And I can tell you already that in the bands of 2 to 5 in my organisation, we see some of the highest levels of sickness. And the sickness that we see, a third of our staff, and we've got high levels of smoking in our workforce population, we see work-associated illnesses associated with that. So we are absolutely aware of the impacts, and it was illuminated beautifully through the pandemic. We have to be able to support our people through our occupational health and our well-being networks. Otherwise, what was the point of some of the lessons that we've learned? So I'm going to pause there because I really know how important it is for us to just have a bit of chat through the Q&A. So thanks, Nadeem.
Thank you, Maggie.